25. Complete the table with words from A, C, and D and opposite E, opposite noun and adjective. Effect, effective. Anxiety, anxious. Behavior, behavioral. Dementia, dementia. Disturbance, disturbance. Suicide, suicidal. Number 2, make word combination using a word from each box. Two words can be used. Please look at B, C, and E opposed to. Behavioral syndrome, eating disorder, major depression, mental retardation. Personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Number 3, okay. Complete the sentence. Look at A, C, D, and E opposed to help. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with again is called senile dementia. A disorder which is not associated with a pathological change is functional. An idea which forces a patient to repeat unnecessary action is a compulsion. 4. Okay. Complete the sentence. No. Which symptom of depression was this patient suffering from? Look at C opposed to healthy. Tiredness, fatigue, loss of interest, and sleeping poorly, insomnia. 26. Complete the table with words from A, B, and C positive. Adjective, unknown. Blind, blindness. Conscious, consciousness. Deaf, deafness. Dizzy, dizziness. Numb, numbness. Leg, hearing, lightheadedness. Steady, steadiness. 2. Make word combination using a word from a box. Look at A, B, and C opposed to help you. Double vision, epileptic fit, prodromal symptoms, psychopath attack, urinary incontinence, and visual acuity. Okay. A doctor is trying to determine the cause of loss of consciousness. Is a 52 years old man. Complete the doctor question. Look at C opposed and at the table 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worrying or you under any stress at the time? Did you feel dizzy or like hidden before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movement while you were unconscious? 27. Okay. Complete the table with words from A and B opposed, noun and adjective. Absent, absence, absent. Diminution, diminution. Flashidity, flashidity, flashed. Apacity, apacity. Wasting, wasted. 2. A doctor is giving instruction to a patient during examination of the motor system. Identify what the doctor is asking in each case. Look at A opposed to help you. I'd like you to relax. I'm just going to move arm up and down, muscle down. Can you see your hands, muscle boot, and possibly involuntary movements? No, I'm going to straighten your arm out. Try to stop me. Try to stop me. Power. Power. Can you touch my finger with your and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Number three. Complete the sentence. Look at A, B, and C opposite and the table in 27.1 above here. Help you. A flaccid hand drop limply to form a right angle with the right. 2. Breathe reflexes are reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. A tick is a form of involuntary movement, a case often used to test the Babinski response. His, his coordination was poor. He could not perform rapid alternative movements. A, a reflex hammer used to reflex. When something is when something is diminished, it is less than normal. 4. A patient is both to I and E in coma. When her name is spoken, she opens her eyes both. She does not answer questions or obey intrusion. What is her uh, uh, HCS score? HCS 5, eye opening to speech 3, verbal response none 1, motor response none 1. 28 1. Verb nouns adjective. Curative, exercise, 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 excision, exit. Ground, growth, growing. Invasion, invasive. Obstruction, obstructive. Palliation, palliative. Palpation, palpable. Spreading. Swelling as well. Okay. Uh, Number 2, the notes below are on the passion described in B opposite. Okay. O E T. Okay. No. Okay. Examination of the central nervous system was normal. CNS NDA. Excuse me. Okay. Okay. Examination of the central nervous system was abnormal. CNS NAD. His mouth and throat were normal. Or a Paris nap. There was a smooth fin 3 4 centimeters mass in the right supraclavicular fossa. A smooth film 3 4 cm mass in our supraclavicular fossa. His cardiovascular and respiratory systems were normal. CVS, NAD, RSNAD. On abdominal examination, there was a mass palpable 3 cm below the left costal margin. ABD, mass palpable 3 cm below L costal margin. 6. On examination, his temperature was 37.8 Celsius. OET 37.8 Celsius. Okay. There were enlarged lymph nodes in both axillae and inguinal areas. Node 1 to SM in diameter palpable in both axillae and inguinal area. His pulse rate was 100 minutes regular and blood pressure 112 series 6. P 100 minutes regular BP 100 112.66. 28.3. Complete the sentence. Look at A, B, and C opposed to help you. Distant spread of tumor cell is known as metastasis, obstruction, metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the speed of primary. If a cure is not possible, palliative treatment should be give a palpable life-saving metastasis. Okay. Complete the sentence. Look at A, B, and C opposed to help you. A baby that is born awake before 2 EDD is premature. A termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage is labor is an indication for cesarean section. It was breech presentation and delivery was be forced. Okay. Miscarriage is another term for spontaneous abortion. The umbilical cord was wound thinly around the baby's leg and it was unfortunately stillborn. 2. Birth not complete. Abort abortion, delivery, induction, miscarriage, presentation, termination. Dr. Bennett and SHO is presenting a patient, a dwelling meal in the obstetric unit of the hospital. Complete the presentation with the correspondence of the birth from 29.2 above. This is Clara Davis. She came to the internal clinic at the 9th week in the past obstetric history. She had a pregnancy when she was 19, which was terminated, and another one a year later, which spontaneous abort. since she had the pregnancy. In the first, the baby was delivered normally for 40 weeks. In the second, she had an induction of a labor 39 weeks. Because of fetal distress, the third baby presented as beige and was delivered by cesarean section. Okay. Third. Blood stained, breath sound, pleural roots, productive cone, vocal resonance. Number 2. Okay. Write, write the question. Is your cone productive? Do you cone opening leg? Is it a loose cone? What color is sputum? What color is the plane? It it is ever purulent? Is it ever yellow? Have you ever had hemoptysis? Have you noticed any blood in stool? Do you suffer from dyspnea? Any problem with your breathing? Are you following statements true or false? Give reasons for your answer. A patient who has a loose cough, producing less true. Grass are hair when the eyes are narrowed, false. A patient who has a non-productive cough produces sputum, false. Wheezes are typical of pleuris, false. A pleural roof is a sign of asthma, false. Okay, 31. Complete the description of herpes zoster shingles by replacing the medical word in brackets with ordinary and English word. Shingles, herpes zoster, usually start with pain and sores the red. Spot, a pet that develop in growth small blister. Vesicle over a particular area on one side of the body in most patients now. Sport lesion continue to spread for 3 to 5 days. The small blister vesicle become filling with pus, post, postular, and then form scab, scroots. In severe case, there may be scars, cicatrices of the war. So, share the description of the rash of rubiola and complete the notes. Location and distribution behind the ear and on the forehead, the truncal limbs, grouping scattered, type of lesion muscular, color pink. 3. Complete the notes for the rash in the photograph and suggest a diagnostic at A and B opposed to help you. Localization and distribution. White radon, the chest and abdomen. Groping scaled type of lesion, small muscles with some scales. Color pink. Complete the Mami, cierra la puerta, please. Complete the notes for the lesion in the photograph. A sugar, a diagnostic look, and A and B opposed to healthy. Location and distribution B. Grouping single. Type of lesion nodule. Color white and 32. Write the corresponding medical term for ordinary English word and say what kind of force on involvement. Look at A opposed to healthy. Common word, medical term, type of force. Bruise, contusion, hematoma, blue. Cut, incited wound, sharp. Grade, abrasion, blue. Scratch, lineal abrasion, blue. Stab wound, penetrating ground, sharp. Tear, laceration, blue. 2. Show the correct word to complete the description of the injured word in the illustration. There are grasses above the left eyebrow and on the left side of the neck, a contusion to the left side of the lower lip and tears to the left cheek. Write a description of the injuries showing the illustration. Look at A and B opposed and at 32 above to help. Where is a laceration? Tear on the left shoulder and an incised wound. A cut approximately 6 cm in leg above the left knife. Complete the sentence. Frequent chain of caution are necessary in the immobile patient to prevent the development of a pressure sore. He had several stabs penetrating one in the abdomen from the knife. He was knocked unconscious by a heavy brown brush to the head. The ones were on superficial and required to treat. Okay, 33. Okay, 1. Frequency and nocturia. Dysuria hentaceae. Extreme little workers, no incontinence apart from occasional delivery. Okay. Match the patient description of the symptoms 1 and 7 with the medical terms. Look at A opposed to healthy. 1. I have to pee every half hour or so. Frequency. I get a scalding pain when I pass water. Dysuria. I have to get up several times to pass water at night. Nocturia. I have to rush to go to the toilet. Perhaps I have trouble getting scared. Hesitancy. I can hold my water. Incontinence. I pass some blood in my urine. Hematuria. Okay. Okay. Describe the thing of the laboratory. Respond in words. Look at the opposed to healthy. There was a trend of loss proteinuria, and knockout. Okay. Okay, yes, allá. Aquí. Okay. A doctor is talking to a patient during an ophthalmoscopy. Match the understanding expression she used 1 and 4 to expression with similar meaning from A opposed A and D. A cold of drug. A topical metric solution. Which will make it easier for me to see the retina. 2. Eye dilatation. 3. I need to get drying of a smooth external line as possible. This meant crossing the beams. The examination is done with demand light. 4. Look straining ahead at that look. Fixated on tiger. two. Okay. Complete the instruction. Look at the opposed to hyphen. Rub the cuff around the patient's upper arm. Place the diaphragm over the area of the brachial artery. Raise the patient arm so that the brachial artery is at the same height as the heart. Close the valve on the pump. Pump, pump up the pressure to as low as 150 mmHg. Open the valve, alight and slowly deflate the cuff while listening and watching the pressure go. The first sound you hear is inflow of blood through the brachial artery. The valve on the gauge at that point is the systolic blood pressure. Continue listening while you slowly deflate the cuff. The diastolic blood pressure is measured when the sound completes the apex. 3. Complete the text. Look at C opposed to help you. Phlebotomists are especially trained in taking blood. They are skilled at venipuncture, puncturing the vein to the take of blood, send the right and for to be caught before after vein in the inner part of the in if difficult to localize suitable vein in the patient may be to make a fair tourniquet may be amplified of the arm and upper arm to make the vein more apparent afterward. Dressing is amplified and the patient is asked to place gently. This helps to stop the bleeding and prevent blushing and decide it is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory. When a full-blown count of the investigation will be carried out. Finish.